Hi all, myself Beno Paul from SNS College of Physiotherapy. Today we can see about the audio visual aids. So these audio visual aids is mainly used for the health communications. So audio visual aids is also called AV aids. So it's a supplementary device used by communicators. So communicators like health workers, teachers or community leaders. So these communicators to make a message cleared, more interesting and easier for the audience to remember. So they appeal to the sense of the sight and hearing. So uses for AV aids, so mainly enhancing understanding. So enhanced understanding to help simplify complex medical concept. So example like using a model to show how a heart valve works. So second uses mainly used for the increased retention. So it can be people generally remember 20% of whatever they hear, and also 30% of whatever they see, and 50% of what they both see and hear. So this is useful for the increasing intention, and it's also used for the overcoming barriers. So like they can bridge gap in the literacy or languages by using pictures and symbols, and loss motivation. So they capture the audience attention and can help stimulate a desire for the behavior changes. Classification of audio visual aids. So we have three classification. First, auditory aids, and second one visual aids, third one combined audio visual aids. So audio visual aids like we can use through the radio, tape record and audio and audio players. So in radio, these are the old type of the devices we can use for this health education. And visual aids, we have two: non-projected aids and projected aids. In non-projected aids, we can use with the chalkboard, that's a blackboard. So most common and versatile aids. And flannel graph, it's also non-projected aids. So mainly the board covered with the flannel cloths. So like a picture or shape flannel blocks can used with the sandpaper or flannel that can be easily attached and moved. And third non-projected aids a flashcard. So it's like a series of cards show in a sequence to tell a story or explain the process of these any process or any technique. And next, flip chart is a large pad of the paper on the stand, often used for summarizing points in a group discussion. Next, model and specimen, it's a 3D representative. So like any model of a mosquito or a sample of the healthy food plate, like to view the in the 3D representative views. And last, poster and chart is a visual summarized placed in the public area to provide a constant reminder. Next, projected aid we can use with a slide presentation or overhead transparency. These are the oldest model, and opaque projector is now used with that project in the teaching rooms. Next, combined audio visual aids is a television and film, digital presentation and demonstration. Television and film, powerful tools for the mass communication, and digital presentation use the software like a PowerPoint or video clip. And demonstration, we can use the audio visual live, and where the health workers explain a process like while simulating performing it, and such a demonstrating hand washing or ORS preparation. So last, guidelines for the using AV aids. So mainly relevance, simplicity, visibility and timing. So in relevance, it must be directly related to the topic and audience culture also. Next, simplicity, it should not be a cluttered with too much text or too many images. And third one, guidelines is a visibility, so it must be a large enough for a person at the back of the room to see clearly. And timing, so these should be only be shown at the appropriate time during a talk to prevent from becoming a distract. Thank you. So limitation, dependency and technical issues also we have, and misinterpretation. Thank you.